In late 2008, doctors across several Nigerian hospitals, particularly in Lagos, began observing a disturbing rise in acute kidney failure among infants and toddlers. The cases were unusual and clustered, with many of the children dying within a few days. Within 2 weeks, over 30 deaths had occurred, and over 50 children were hospitalized with the same condition. This number far exceeded the usual number of cases recorded by the hospitals. The pattern was clear. Previously healthy children were developing kidney failure without prior signs of illness. The only clue was a common medication used by parents of these children, a liquid teething syrup called Pikin. These concerns were escalated to the Federal Ministry of Health, which then prompted the launch of an urgent investigation by the National Agency for Food, Drug Administration and Control, NAFDAC. On November 21, 2008, NAFDAC launched an investigation to piece together the full scale of the disaster. What they found was an all-too-familiar mistake, one that has historically cost the lives of children in Nigeria and other countries. The manufacturer of Pikin, Barewa Pharmaceuticals, had substituted propylene glycol, a safe pharmaceutical solvent, with the cheaper but more dangerous diethylene glycol, a toxic substance commonly found in antifreeze, brake fluids, and industrial cleaners. Several bottles collected from patients' homes tested positive, and 4 entire batches from the production site confirmed it. By early 2009, Pikin-linked cases had been confirmed in 3 states: Lagos, Kaduna, and Osun. Out of 55 children who had exposure to the teething medication, 54 of them passed away. The product was immediately recalled and NAFDAC shut down the production facility. While Pikin was eventually banned and legal action was taken against the manufacturers, the tragedy highlighted the gaps in pharmaceutical regulation and enforcement in Nigeria at the time. In the end, over 50 children lost their lives. The youngest was just a few months old. But this wasn't the first time the world had seen diethylene glycol strike. It had killed in Panama, in Bangladesh, and even in Nigeria once before, back in 1990. It was always the same story: unregulated production, ignored safety protocols, and a lack of enforcement. And the victims were always the most vulnerable. This tragedy remains a haunting reminder of what happens when profit is prioritized over protection, and why trust in medicine must be constantly earned and fiercely guarded.